Hi, I'm Dr. Lee Kurisko. I'm Chief Medical Officer of Kurisko & Company Corporate Wellness. I'm a practicing radiologist. Earlier in my career, I was a family doctor working in my office, the emergency department, operating room, and caring for patients on the hospital wards. I've completed fellowships in neuroradiology as well as anti-aging and functional medicine. I graduated medical school in 1988 and have worked both in Canada and the US. So needless to say, I've been around the block in the healthcare world. For me, the most exciting thing that I have ever learned is the true agency that we actually have over our health future with the lifestyle choices that we make. So why whole food plant-based? For starters, did you know that people that eat entirely plant-based diets have the healthiest body weight? It's true. People that eat an entirely plant-based diet have an average body mass index of 23, which fits nicely in the normal range. Anything above 25 is overweight and over 30 is obese. The average BMI in the US is 28, which is well into the overweight range. With 74% of the US population overweight or obese, the importance of a plant-based diet cannot be overstated. Normal weight can be achieved and maintained without taking special supplements or drugs or getting bariatric surgery. There's no calorie counting or portion control. Simply learning to make the right food choices is the key to attaining and maintaining a trim, healthy body. Sounds too good to be true, but it is true. The entirely plant-consuming subjects in the large Adventist and Epic Panacea studies maintain perfect body weight for their lifetimes by just making the right choices. It's been known for over a century that plant-based diets promote robust health. Missionary physician and surgeon Dennis Burkitt, working in Uganda way back in the 1940s, noticed that the native population eating an unprocessed whole food plant-based diet, rich in dietary fiber, had virtually none of the common diseases that he was used to treating in Britain.
But over the last 20 years, just over, I switched entirely from trying to cure disease to go 100% into trying to prevent disease. Because it wasn't until I came back from 20 years surgical practice in Africa that I was helped largely by others to appreciate that most of the common chronic diseases filling the hospital beds in Western countries today are rare or unknown in the Third World, were rare even in North America before the First World War, are equally common in Black and white Americans, and therefore they have to be due to our lifestyle, the way we live, and in which case they've got to be preventable if we can identify the factors in our lifestyle. So it was rather like climbing a hill, and you go over a new horizon, and you see a whole new panorama in front of you. And when I saw this panorama in front of me, I felt that we were really largely wasting our time by spending all our time treating disease which could be prevented in the first place.
During World War I, one of the greatest nutritional experiments of all time was inadvertently performed, showing the incredible power of eating plants. A naval blockade of Denmark threatened serious food shortages. The Danes were forced to abandon animal husbandry and eat the crops that would normally be fed to animals. Despite living with wartime stress, the death rate in Denmark dropped by 34% to their lowest rate in recorded history. 3 million Danes were unintentional subjects in an experiment that would be impossible to perform today. Guess what happened when the war ended and people abandoned their plant-based diet? The death rate went right back up. The Adventist studies have also shown that people eating entirely plant-based have the lowest rates of type 2 diabetes, which is a modern scourge. According to the Center for Disease Control, diabetes now afflicts 12% of the adult population, with 38% of the adults being pre-diabetic. It is crucial to take action to prevent it. If trends continue, 33% of the population will be fully diabetic by 2050. But don't worry, even if you are diabetic or pre-diabetic, 90% of cases can be reversed within 6 months with a properly applied plant-based diet. From my personal experience, I solved my prediabetes within just 3 days of adopting a plant-based diet. Not everyone will have such quick results, but almost everyone can improve. Diabetes massively increases the risk for stroke, heart attacks, blindness, amputations, kidney failure, dementia, and cancer. Whoa, who wants that? Although fad diets like keto, carnivore, and paleo diets can improve diabetic blood sugar levels in the short term, they don't actually address the underlying root cause, which is insulin resistance. In fact, the insulin resistance can get worse on these diets, while the blood sugar control seems to be improving. There is research going back to the 1920s supporting a plant-based approach to diabetes, but sadly most physicians, even endocrinologists, are unaware of this. In future videos, we will teach you how to fix your blood sugar while getting rid of the insulin resistance. Here's the best part. You can do all of this while eating as many carbs as you like. They just need to be the right kind of carbs. Stick with us and you will learn how to do this and why it works so incredibly well. Here's an important warning. If you are on diabetes or blood pressure medications, the switch to a whole food plant-based diet can be so effective that your blood sugar or blood pressure can drop very quickly, so you must work with your physician to adjust your medications. Let's just backtrack for a moment. What is a whole food plant-based diet? This is a diet in which the majority or all of the calories are derived from plants and as close to their natural form as possible. Food as grown, rather than manufactured in a factory. Eat whole plants rather than food created in a plant. Whole plant foods include whole grains, legumes, fruit, vegetables, nuts, seeds, and spices. Don't worry, you can have more variety in your diet than you do now. There are literally thousands of edible plants, and the recipes can be delicious. Beverages include tea, coffee, and water. Does that mean that you can never eat meat again? We encourage the reduction of animal products to as low as you're willing to go. The evidence is very compelling that the less animal products that you consume, the better off you will be. Can I say with absolute certainty that zero animal products will be best for your health? No, but I believe that the evidence points in that direction. I haven't consumed any animal products in 8 years, and I'm the healthiest 66-year-old that I know. Although we encourage you to reduce your consumption of animal products and processed food as much as possible, we are not your boss, and you can go as far with this as you are willing. We don't want perfection to be the enemy of the good. But keep in mind that the quickest and most dramatic results in terms of health and weight management will be with the biggest dietary changes. We also recommend the reduction of processed food as much as possible. This includes things like cakes, cookies, candy bars, soda, chips, and fast food. If the ingredient list on the package includes words that you can't pronounce, steer clear. The best foods of all don't have ingredient lists. Apples and sweet potatoes don't have an ingredient list. When you do eat foods with multiple ingredients, we will teach you tips on how to read labels to make the best choices. We live in an era of rampant chronic disease. Healthcare costs are out of control. In the U.S., we now spend $4.9 trillion per year on healthcare, and most of that goes into managing chronic disease. Here's what is really interesting. Most chronic disease is related to lifestyle, and the most important lifestyle factor seems to be nutrition. Here are some facts that you likely don't know. Heart disease, the #1 killer, can be prevented and even reversed with a whole food plant-based diet. Dr. Caldwell Esselstyn has published data showing that his whole food plant-based dietary therapy results in cardiac event rates of only about 1/100th of controls given standard dietary counseling. There seems to be a very strong link between diet and cancer. Dr. Dean Ornish ran a trial showing that he could frequently reverse the activity of prostate cancer in men consuming a whole food plant-based diet. Very recently, he published a trial showing that mild cognitive impairment and early Alzheimer's could be reversed in some patients with the same diet. There are places in the world where breast cancer rates are a fraction of what they are in the U.S. Asian women consuming a traditional diet based on rice and vegetables only have about 1/5 of the breast cancer rates of Americans. Some countries like Ghana, eating an unprocessed plant-predominant diet, only have breast cancer rates of about 3% of what they are in America. There are many other diseases with compelling evidence that a whole food plant-based diet can be helpful. These include high blood pressure, some types of arthritis, kidney disease, and autoimmunity. Here is something else to keep in mind. With most dietary changes like cutting calories or carbohydrates, the longer you do it, the harder it gets. Not so with a plant-based diet. The longer you do it, the easier it gets. After 8 years, I cannot imagine eating any other way. Remember I mentioned the weight management benefits of a plant-based diet? That's great, but what really excites me as a physician is not how people will look in their swim trunks, but actually helping people get well. At Kurisko & Company, we sincerely hope that you will join us on a path to better health with a whole food, plant-based diet.